VHI. Y hola, me llamo Nikki Fedoroviches, soy la directora ejecutiva de Vision Health International. Buenas tardes, bienvenidos. Estoy aquí con Meaghan Frisbee, nuestro jefa de program. And welcome everybody. I'm here with Meaghan Frisbee, who is our Chief Program Officer. And we're really excited to be trying this for the first time. So welcome. And we hope that you guys will enjoy our conversation today and send us any comments or questions. We're really looking forward to discussing, what's been going on with COVID-19 and VHI and our most recent trip to Honduras. We will be talking for 30 minutes today. And yeah, we're just really looking forward to this. Meaghan, did you want to add anything to that?
Yeah, so just hello. It's hopefully everyone can see us, and we're excited to see who all is able to join us and just give an update on where we're at with VHI, where we're at with our programs. We miss all of you. We miss our volunteers. We miss our hosts. And so it's nice to be able to give an update and hopefully connect with some of you via Facebook Live.
Sí, y alguien que escriba en español, por favor, mandas nuestras preguntas en español y intentamos hacer respuestas en español e inglés. Okay, so Meaghan, VHI has been, Lisa Bates has joined us in the house, yay. VHI, this is our 35th year of providing the gift of sight. And we were looking so forward to doing so much in 2020. Can you just bring us up to date with where we are with our programs?
Yeah, so as everyone knows, COVID-19 is upturning organizations and people and people's lives and travel plans. And as a result of that, we made the decision to cancel our program to Honduras, which was to have taken place the 21st to the 29th of March. Shortly thereafter, we also decided to cancel our trips to Guatemala, our day trip with the Stout Street Clinic, and our trip to Tanzania at the end of June. So we're disappointed that we weren't able to go to Honduras, but we have some updates that we're excited to share with you about what we're still doing in the meantime.
So let's just focus in right now on Honduras. Can you tell me, just walk me through the days leading up to the decision to postpone the trip? What was going on?
Yeah. So as everyone knows, the situation when it first came to the US early March was changing so much daily that we were in daily contact with you, with the doctors who were scheduled to lead the trip, and with our host organization, the Manos Amigas Clinic in Honduras, trying to figure out, is it safe for us to go? Is it safe for the people that we're going to serve, coming from a place where we just have some cases coming up? We ultimately made the decision to postpone the trip to the fall. And once we made that decision, we were very confident that it was the right decision to have made. And we were happy to have done it with our partners in Honduras so that it was kind of a group consensus.
Just for the viewers at home, a week earlier, we had our team meeting with the group that was going down there. And so from a Saturday to, was it the following Monday, Tuesday is when things really changed, right? Mm-hmm. It was that rapid.
Yeah. The situation daily and still continues to change daily. I feel like one of the reasons that we also decided to postpone trips later this summer is because we just don't know where we'll be at, and things are changing so rapidly that we want to make sure that everyone is safe and doesn't have challenges with their travel.
Yeah. I just want to welcome everybody again. I'm Nikki Fedoroviches. I'm the executive director of VHI and a volunteer. And I'm talking with Meaghan Frisbee, who's our chief program officer. And we're really excited to have our first Facebook Live chat today. And we're talking about Honduras, which is our most recent program that we had to postpone, but also what we're doing in the future. And we're really, if you have any questions for us, send them here and we'll try to answer. Y hablamos español. So si tiene algunas preguntas en español, por favor, give them to us. So tell me a little bit more about the partnership with the clinic in Honduras and just like how that works in terms of perspective. Like we were getting information in the United States and they're getting information from their sources. How does that work and how does it come together?
Yeah, so I feel really fortunate that we have such a strong partnership with the clinic in Honduras. We've made a long-term commitment to that community, and they've made a long-term commitment to us so that we can work to build sustainable eye care in the region. We've been to Honduras probably 12 times now. I mean, we've been going at least twice a year for several years. And as a result, we have really strong relationships with the people who run the clinic in Honduras. Delmi's the clinic director. Karen, who's going to become the optometrist, she's studying optometry. And so when we were leading up to the trip and trying to decide if we were going to do it, if we were going to cancel, it was nice to be able to have daily calls and emails with people on the ground in Honduras telling us about the situation there. We were telling them about what was going on here. You know, you hear things in the news and you get statistics, but what's really important to understand is what actually is happening on the ground. And so with our partnership with them, it was a really good way to, you know, ask questions, find out if we felt like it was a safe situation or not, and decide together. It was a good partnership.
And I know a year and a half ago, there was another trip that also we had to make some very, very quick last minute decisions when it was the week that the Hondurans had their presidential election. And again, if you could just sort of walk that week through, just like how quickly things were changing and what that meant for us.
Yeah, in December of 2017, we had a trip planned. I think it was the first week of December to go to Honduras and do the same thing, cataract surgery, vision screening, and eyeglasses. And a couple weeks prior to the scheduled trip, they had a presidential election. The president wasn't releasing the vote count. And so day to day, the situation was worsening. They were, you know, at first it was like, oh, shoot, they haven't released the results. I wonder if this is going to be strange. Do we want to go down there? And then the next day they were burning toll booths. And then the next day, you know, we talked to Delmi and she said, I really think you guys probably don't want to come. So we made the decision not to do the trip, and then later found out that the airlines had canceled flights to the country and all sorts of other things had happened. But what I feel good about as an organization, is that we are always very aware of our volunteers' safety and always working with our local partners to understand the situation on the ground. So we have been fortunate to have made decisions to cancel trips in the past, well before we really had to cancel them, and then found out afterwards that it was good that we had canceled. So we're good about, I think, being pretty proactive about canceling trips when we feel like it's a safety issue. And the December trip that we canceled, we ended up making up for the cases of surgery that we had to postpone on the trip after in March. So we were still able to take care of all those patients who were not able to get surgery in December, but we did them in March.
So I just want to welcome, is it Daniel Guzman from Guatemala and Evelyn Garcia and Pichito Veliz.
Hola,
All
Pichito.
saying hi.
Hi, Evelyn.
And
Hi, Danielle.
Sloan is with us. And again, we're just here, Meaghan and I are chatting about Honduras and about how, you know, this COVID virus really came quickly and changed our plans and what that means. So we did postpone this trip, and it is very disappointing for us for many reasons, right? I mean, our goal is to change people's lives by giving the gift of sight. So we think about the volunteers and we think about the community. Can you just say, like, what are some of the hardest parts for you and for the organization for when we have to postpone a trip like this?
Yeah. So first I want to say hi to Evelyn and Danielle because they are our partners in Guatemala. So we had to also postpone our trip to Guatemala, working with Evelyn and Danielle in Guastatoya. So bienvenidos. I'm glad you guys are here. It's nice to see you on the call. And hola, Pichito. The hardest part about canceling a trip is that we know that when we cancel, there are so many people who have been waiting for us to come and help them with their vision needs. So I just talked to Karen today, who's the optometrist in Honduras, and she told me there's a woman, Juana, who's 64 years old and has cataracts in both eyes. One of the eyes she can't see more than a foot in front of her face. So that woman who is living with her granddaughter, unable to work, won't be able to have the cataract surgery that she was hoping for in March, and instead will have to wait another 6 months. And for us, 6 months might fly by, but when you think about someone who's lost their vision and has been waiting and hoping to have that taken care of with the surgery, like cataract surgery, which you can see from one day to the next, it's really disappointing. And so I just think about the 150 patients that we had scheduled for surgery, in addition to the 750 people who were looking forward to having their eyes checked and being given free eyeglasses, and just taking care of their vision needs in general. I think all of those people are probably disappointed that we're not coming. And so I just think about how important it is that we continue to partner with the organizations with which we partner so that we can take care of all of those people on the next trip when we go down there. I think it's just so important because even if we're not able to be there, people's vision care needs continue, and they will have less access to eye care going forward, just because of the global situation and the financial crisis that goes along with it. So our work is needed now more than ever.
More than ever. I just want to welcome everybody who's joined us. This is our first time for VHI to do a live chat. I think we're all experiencing this now, that when we're like innovating and trying new ways to have an impact and communicate. And so this is our first attempt at a Facebook Live. And so we appreciate all of you tuning in. And we hope that you will get a little update on how the COVID-19 virus has affected our work. And you'll learn how we're dealing with that and how that's going to affect our plans going forward, and some of the interesting things that we're hoping to do. So, bienvenidos todos para la primera vez a Facebook Live con Meaghan y yo. So thinking about the future, can you just talk about some of the ways we've brainstormed to continue to support the local community in Honduras?
Yeah, so working with the Honduras clinic, they have said that they would like to be able to provide eye care independently. And our goal at VHI, our mission and vision, is to leave communities with sustainable access to eye care. So Mike and Delmy and Randy, our medical director, have all been meeting, and we've been talking about how can we enable the clinic in Honduras to function and survive and thrive without VHI's twice yearly trips eventually at some point in the future, leaving a community with access to eye care. And they've identified that they would love to have an optical shop. So a place where they can check people, see if they need glasses, have them pick out a pair of glasses, make their glasses on the spot, and essentially they could be able to go home that day, or at the very latest within a couple of weeks, with a new pair of eyeglasses. The situation today in Honduras at that clinic, they don't have an edger, they don't have an optician. So if someone needs eyeglasses, they either have to wait till VHI comes down for one of our 2 yearly trips, or they would have to go to a city and spend money out of pocket to get eyeglasses. So there really is very little access to care. And we're working with that clinic to have them fully able to provide eyeglasses, to diagnose eye issues, and then hopefully eventually also provide eye surgery.
Nice. Yeah, so we've, like you said, been there maybe 12 times. And again, VHI has been working in communities around the world for 35 years. We're really proud of the fact that even though we've experienced other, not so much pandemics, but other disruptions in our programs, we have always been able to plan the future and get back to the work that we want to do and love to do and is important to us. So while this is a sort of a temporary break in our programs, we know that there is a future, and that's what we're looking forward to. So for the people that have joined us, let's see, Consuelo is there, and
Hola, Feli. ¿Cómo estás?
um, can you think of ways that people that are watching could help to support the local community, or what would be the best way to support VHI right now?
Yeah, so I think if people have means and are able, VHI is always accepting donations, and those donations go to helping our programs. If people want to volunteer or they know of people who would be interested in volunteering, we love to bring Spanish speaking volunteers. Right now, even though our programs are paused for this spring and summer, I am still actively planning trips to Honduras in November, Tanzania in next summer, Guatemala. So we have lots of programs coming up, which I recruit for 6 months in advance. Also, if you have any suggestions for VHI, yeah. And then the other thing is just keep up to date with our Facebook page, our emails. We'll be having more information coming out about the work we're doing in the local communities. And just because we can't physically be in a location, we are trying to think out of the box of ways we can help the communities in which we serve.
Yeah, and I think, we have a pretty active Facebook page and an Instagram page. For those of you who, well, I guess everyone who's on Facebook right now sees us, but we're also on Instagram, and we do have an email, and obviously now more important than ever to stay in touch through these virtual means. Which reminds me, we are a virtual organization, so we are pretty comfortable working like this, like remotely. Meaghan and I meet like face to face like this all the time, and we have so many meetings. We've been on Zoom thanks to one of our board members, Courtney, I think for 3 years, and before that WebEx. So while this pandemic has pushed our programs off as an organization, this is how we regularly function, virtually. So we feel lucky about that. We feel also lucky right now that we're a pretty nimble and flexible organization, and just so appreciative of our volunteers and supporters and friends over the years. So we're organizationally, this feels okay, and it just doesn't feel great not to be doing the work that we do. You can sign up for our emails on our website, and our website is visionhealth.org. And you can sign up there and get onto our email list. I just want to welcome everybody to our first Facebook Live chat. I'm Nikki Fedorovicius, the executive director. I've started off as a volunteer in 2005 to Nicaragua and was hooked ever since. And I'm with Meaghan, and she has been our chief program officer for 5 years, right?
Yeah.
Yep.
Since 2015.
Yep, 2015. And we're here today. We wanted to take our work live, and if you have any questions, send them in, and we can try to answer them. Podemos hacer preguntas en español y inglés, más o menos, depende. Y estamos really glad that we're here. So here to just chat about what's been going on in Honduras and how our local partners are doing. Do you have a sense right now what's happening in the clinic in Honduras?
Yeah, so the situation is pretty dire in Honduras. The clinic has closed. The government has been very I would say very proactive in prohibiting gatherings of any number of people. I think people can only go grocery shopping 3 days a week. There is no public transportation. And so I think the clinic was willing and wanting to stay open, but people didn't have a way to get to them. So they ended up closing their doors, but I know that they're eager to open up again as soon as possible. And they're working with the local health ministry to find out when that could be. We talked to Delmi, our clinic director, and she said that there is some food scarcity. People are allowed to grocery shop only 3 days a week. And when they go to the stores, maybe there's food, maybe there's not what they're looking for. a lot of people have been laid off or don't have work, can't sell their produce in the markets, and there's no social safety net like we have in the States. So there's no official unemployment. People are lucky if they get half of their salary. But as we all know, the expenses continue. So I think that we will continue to be sending thoughts and prayers to our partners in Honduras and the people that we serve there, and just hoping that this is over soon and that they can resume normal activities.
And can you just say, but first I just want to say hi to Alex Mosley, who's I think in the Denver area, and Patricia Melgar. She's from Guatemala, saying hola. So welcome. And Lisa Bates went to Honduras on one of our first, well, I think it was when we first in the 90s. So it's kind of nice to have her circling back here. So tell us a little bit about the different partners. We've got the clinic, which is the name and all that, and also who their partner is in the United States.
Yeah, so the clinic that we partner with in Honduras is called the Clínica Manos Amigas, Helping Hands. And they are a fully registered nonprofit organization in Honduras. And they're all local Honduran staff, a Honduran board of directors. It's a really cool model. They're supported by a foundation in the United States called Serving at the Crossroads. And so they work very closely, I think, to bring the medical care that they do to the region in Honduras.
And I guess for us, we have different partners and partnerships throughout the world. So, it looks different wherever we go, whether it's Guatemala or Honduras, the Flathead Indian Reservation,
Yeah.
Stout Street in Denver. It just depends on the model, but we always have a local partner to.
Right. So I think we have Evelyn and Danielle on the call. They are active volunteers with the Lions Club of Utatlan. I hope I'm pronouncing that correctly, in Guatemala. And so they are really critical in facilitating our work when we go to Guatemala, organizing projects with the local government. So for the first couple of years, we worked with Amatitlan in the local hospital. And then this year, we were really looking forward to going to a new community, Guastatoya, working with the mayor there. So I'm hopeful that that will continue and we can pick up where we left off with our next trip to Guatemala, to a new community, working with the local hospital and the mayor's office. But our partnerships are really critical to how we operate. We don't work in a silo. We love to address local needs. And so when people say, we really want you to come and we want to focus on children, or we really want you to come and we have a lot of cataracts or adult blindness, or there's a lot of eye disease. So we always want to be receptive to what our partners in the country want and feel the need is for.
Right. We work by invitation. Yeah. Mm-hmm. So Christine Marsden, she has said, count me in for Honduras in the fall.
All right, Christine.
Yep. And Paul O'Rourke has joined us to say hi. And Paul, he's a just our past president, longtime volunteer, director of development, been on lots of trips with him. So hi Paul. Yeah.
Paul was affected by the cancellation to Tanzania. So Paul and Melinda and I had been talking a lot about that trip coming up in June. We're really happy and confident that the decision to move it out a year is the right decision. So we're recruiting for that trip next June, Tanzania.
And there you go. And it's 5:23. Karen Nason, I'm not sure if that's how you say your last name, Karen, but hi, welcome. Hi, we've got about 7 more minutes to chat. Again, I'm Nikki Fedorovicius, Executive Director. I'm with Meaghan Frisbee. She's our Chief Program Officer. And we're loving all these people jumping on and sending some messages to us. We can hacerlo en español y en inglés también. So if you have any questions, burning questions, that you want us to answer, this is the time. Hi, Mandy. That's Mandy Lynch. She's another board member. And the thing about our volunteers is that so many of them work in healthcare in their home city, their home country. And, we're, thinking about them and hoping that they're staying healthy and safe, and just a lot of gratitude for their service.
Yeah, I think of our VHI trips as getting together with old friends. I think we get such good volunteers and people with like-minded community service. And so when I thought about canceling the trip to Honduras, it made me sad just because of all the people who also don't get to spend that week together. Some people go year after year, and sometimes it's their first time, but you form these lifelong friendships. So I'm really glad to see Karen on the call, and Christine and Mandy, a bunch of people who I know were really looking forward to the Honduras trip. So hi to all of you. It's a virtual hug via Facebook Live.
And in fact, as we're chatting and you're chatting, I'm seeing that Lisa Bates is saying hi to Paul from Lisa and Phil. So I think one of the things that I know I've loved since 2005 is like you said, it's the coming together of kind of old friends to serve one purpose, which isn't political, it's not religious, it's purely to change somebody's eyesight. And then we have these connections throughout our lives and across the miles and countries. And I'm just seeing that right now as Lisa's saying hi to Paul. So that's great. Yeah. And this Facebook Live, while we're doing it now, we'll be doing it for 5 more minutes. It'll be, I think, available on our Facebook page if you want to come back to it. And if there's something that we said that you want to double check, I think it'll be there. And we'll just double check on that part. But yeah, so we've got 5 more minutes left if anybody has any questions. And Meaghan, what would you say like your biggest hope is for VHI and just kind of like the next, 6 to 24 months?
Yeah, so I would just say the need in the countries that we serve is always going to be there. And so I am so hopeful that we will come out of the other end of this with people with a renewed passion to volunteer, a renewed passion to do what they can for the communities that we serve, because the patients will be there and we will take care of them. So even though people have had to wait an extra 6 months maybe or an extra year for their surgery, we want to just guarantee everyone that we'll be there when this is over, and the need will be greater than ever, and we'll be there to help. That we've got great volunteers, we've got great donors, we've got an incredible team, and I'm just really looking forward to seeing all the smiling faces in Honduras and Guatemala and Tanzania and Flathead when this is all over. And I think people will also be ready for that. I think it'll be a really heartwarming time when we're ready.
And I got to say that one thing I'm enjoying, because I'm seeing everybody's comments and names, which is so great. And Rick Whitten, who is a founding member of VHI, has just joined. He's also saying hi to Lisa and Paul. And I just think it's really so important that you all know our volunteers and just how important you are to the mission of VHI. And we have so much, gratitude when we have to cancel or change a trip, and it weighs heavily on us on how that affects all of our lives and how people have planned for childcare, for all kinds of arrangements, and we don't take that lightly at all. So we just are really grateful for people understanding, kind of how this business works. It's not simple, but it's super important, super gratifying. So thank you. Oh, hi, Catherine works there. She's also saying hi. Paul's saying hi back to Rick and Lisa. So yeah, just 2 more minutes with us today. But Meaghan and I have been working together for 5 years, and we just follow in the same footsteps as the people who came before us, Sarah and Cindy, and a lot of board members who have guided the organizations through all kinds of changes. And we're lucky to have 35 years of history, and we're lucky to have strong partners and strong supporters. And I think that'll just really carry us through this new time in our lives, and really a historical moment for all of us. Y estamos casi al fin de nuestro Facebook Live. Estamos muy agradecimientos sobre nuestro apoyo y historia. I'm like, no hablo, pero no soy nativa. But really just so grateful. Thank you all for joining us today. Meaghan, do you have any last parting words you want to share with our listeners, our followers?
Just thank you very much for joining. Thank you for supporting VHI. Thank you for volunteering. We wouldn't be what we are without all of you. And so thank you from the bottom of my heart.
Yep. And if you all have ideas about how we can bring what we do to other people or to the greater community, please let us know. You can send us an email, you can send us a Facebook message, all kinds of ways to contact us. You can go on our website. There's an actual place to, I think, write to us. So let us know. We're open. But thank you guys so much for joining us today to learn more about COVID-19 and how that's affected our, most recent trip to Honduras and then going forward. We really appreciate it. And we will look forward to seeing you all on the road, in the field, and on Facebook and other ways. Thanks so much.
Bye.
Bye.